New figures show the incidence of bowel cancer is likely to rise by 50% over the next decade as the population ages.
We're in a unique position in cancer research. On one hand, our research and treatments have developed immensely over the past few decades, but we still don't really understand why cases in young people are rising.
I was one of the ones that sort of thought bowel cancer is an old person's disease. I couldn't verbalise it. It was really hard to say the words, listen, I've got cancer.
The difficulty of cancer treatments is that you never know exactly which one the patient is going to respond to.
The truth is, a lot of the treatments we use in oncology for advanced cancer stop working after a few years, or even after a few months. Sometimes, they don't even work at all.
My name is Shehara Mendis and I'm a medical oncologist and a clinical researcher.
After I became an oncologist, I felt this drive and commitment to continue learning beyond the clinic. I studied the Master of Cancer Sciences because I wanted the skill set to analyse existing research and to create my own research in a well-executed way. It wasn't just about learning what the research says, because that can change within a month. It's about learning how to be a researcher, how to analyse and how to communicate that research. You are on that journey with an individual, and it's fundamental in that care that you are bringing the latest research and evidence into your clinical work. So when you're seeing a patient in the clinic, you can contextualise that research for them, make recommendations, and say with confidence, this is the best thing for you right now. I don't like the term cancer battle, but it does take an army. Cancer care takes more than just doctors. It takes scientists, pharmacists, nurses, allied health, study coordinators, all working together. And we need these people bringing their perspectives and experiences to contribute to the ever-evolving research and improve what we do. The research machinery, it's a slow burn, but you are doing it with a group of incredible individuals, and you're contributing to decades of work and dedication from your predecessors, with a chance to be part of something that will make change at a vast scale. The Master of Cancer Sciences course is quite connected with several cancer research institutions, including the WEHI. For the past 20 years, the Gibbs Lab at the WEHI has kept a colorectal cancer registry to capture our patients' progress. Having long-standing records means we can better understand what happens to our patients beyond clinical trials. A really incredible part of being a clinical researcher is that if I'm involved in a new promising trial, I have the ability to offer my patients that particular trial. There is a balance between my two roles. On the one hand, the research side is improving lives in the long term, but the clinical practice is where I get to improve lives in the here and now. There is nothing more rewarding than when a patient of mine stays in remission and I get to say to them, "You've graduated from the oncology unit, you don't need to see me again." I think that's a pretty special privilege to be part of.